You are listening to an update from Washington with the Congressman from Alabama's 1st Congressional District, Bradley Byrne. Now from our nation's capital, Congressman Byrne.
Welcome to an update from Washington with Congressman Bradley Byrne. I'm Seth Morrow. Congressman, let's jump right into some questions. I know taking care of our nation's veterans is a big issue and a major debate in Congress. Can you talk about some of the ongoing problems at the VA?
Yes, Seth, unfortunately, we continue to have a problem with the VA not taking care of our veterans appropriately. Now, this comes up most often with regard to VA health care, but we do have problems with VA claims for benefits, monetary benefits. So I hope everybody listening will let us know if they're having problems. The big problem with the VA healthcare system is that it's just not adequately responsive, either in what they provide or when they provide it to our veterans. So we stay very involved with our local outpatient clinic. We have one in Mobile down on Spring Hill Avenue, and we have another up in Monroeville. So we stay in touch with them. And then, the hospital that most of our veterans were sent to is the one over in Biloxi. We stay in touch with them. But we still have problems with veterans not getting the health care that they need when they need it. And so we continue to work very hard on trying to make sure that we're doing right by our veterans because they're the ones that fought for our country.
And I understand you're working on a bill and you have a big push to try to increase veteran access to private health care. Can you talk about that?
Yeah, the law we passed last summer supposedly gave our veterans the real option of being able to get their health care in their local communities, from their local hospitals and their local private sector physicians. But the way the VA system is being interpreting it really just hasn't worked out that way. So I put together a bill and sponsored a bill called the Real Choice for Veterans Act. We have a number of sponsors now. And essentially what it does is make it very clear. If you live within a certain number of miles or you've been waiting for over 30 days, you can go and get your health care, if you're a veteran entitled to health care benefits, in your local community, from your local hospital, your local physicians, and you will get the health care you need by the people that live nearest to you.
Well, in the meantime, I know a lot of veterans in Southwest Alabama have to seek medical care from the clinic in Mobile. You mentioned that. But I understand that you have some concerns about that clinic?
Yeah, if you go there, and I'm sure the number of people listening have been there, if you go there, it's an old facility. It's the old Providence Hospital on Spring Hill Avenue. And it just wasn't built for the sort of activities that we have going on in that clinic today. And so they need a new building. The VA system has said they're going to get a new building. They've been out trying to get a new building or build a new building for several years now, and they're just dragging their feet. So we're pushing them as hard as we can to get them to either purchase an existing building or to build a new building as quickly as they can so that our veterans not only will have a nicer facility to go to, but the quality of the care they're going to get is going to be better because they'll be able to get it in an appropriate environment. And this is everything from people that have some potentially PTSD problems to people who have other physical ailments that they need to have a different physical setting to be treated in. So we're going to continue to work very hard on that, along with this Real Choice for Veterans Act, so that choice card will really be meaningful to our veterans. 80% of the casework we do in our office in the district is for veterans. So we really want our veterans to call us, let us know if we can help them. And that not only helps me help them in their individual case, it helps me understand what we need to do about changing the law up here in Washington.
So if someone's listening and they or someone in their family is having a problem with the VA or getting the benefits they deserve, what can they do?
Well, the most important thing they can do is to call our office in Mobile. And let me give you that number. It's 251-690-2811. That's 251-690-2811. Call. Tell them your problem. They're going to ask you to fill out a form, and we have to have that in order to intervene for you. And then we will get to work on your behalf to try to find a solution to your problem, whether it's these monetary benefits or it's the health care benefits or whatever you need from the VA that you're not getting. That's what we're there for, and we do it a lot. So if you know somebody in your neighborhood, a friend, somebody you go to church with, or particularly if you have somebody in your family, give us a call. We want to help in any way we possibly can. We can't guarantee results. We guarantee we'll work hard at it.
Well, I think we're out of time, Congressman.
Yeah, let me just thank everybody for listening. It's very important for us to stay in touch with you. So stay in touch with us in our office, and we look forward to talking to you next week.
You have been listening to an update from Washington with Congressman Bradley Byrne. Congressman Byrne encourages you to contact him with any comments or questions. You can email him online at byrne.house.gov or find him on Facebook under U.S. Representative Bradley Byrne. Stay tuned to this station next week for another timely report from our nation's capital. This broadcast has been pre-recorded.